Thank you very much. My name is Angelina Namiba, and I'm going to be speaking against the proposition that integrase inhibitors cause weight gain. We know the reality is that over the past 2 decades, global trends have shown an increase in weight, increase in the general population over time. And this is across lots of different countries and lots of different continents. But we also know that weight gains and rates of obesity in people living with HIV is very much similar to that of the general population. So, this is why I miss face-to-face meetings. But for now, what I'll just say before I continue, please type yes in the chat if you have put on weight in the past 5 years. I think you'll all agree that many of us have put on weight in the past 5 years, right? But the reality is that as a population, we're doing less, we're eating more, we're meeting less, we have more screen time, and we have more choice on what to eat and also access to what to eat. So for example, down my street, in a 5-minute walk, I have access to more than 30 or 40 restaurants, cafes, bars, supermarkets where I can actually access food. But we also know that those who are losing weight are the gym bunnies amongst us who are actively trying to keep fit. And of course, those people who are unwell. And so when we're interpreting weight gain with people who are taking integrase inhibitors, we need to look at these environmental impacts and factors. We also know that there are actually lots of other intersecting factors, including ARTs, that can affect our weight as people living with HIV. There's genetics, the diet that we eat in the different populations. There's also people who have comorbidities. Some of these illnesses make us put on weight, but in line with that, some of this medication that we take for these comorbidities can also make us put on weight. We also know that when we're actively encouraging people to test early, so they're diagnosed earlier, they're starting treatment earlier. These integrase inhibitors are less toxic drugs, they're better tolerated, and so people are taking them while they're adhering, and they're living well, healthily, and living their best lives. The other point I'd like to make is that we need to always stop looking at weight gain as a bad thing. The study here showed that actually, even though the women who were taking ARVs did put on some weight, it was actually compared to their HIV negative counterparts, the weight that they put on was near to, but not actually up to the weight gain that is recommended in the second and third trimester based on the Institute of Medicine standards. And what the study also showed is that weight gain was significantly associated with the lower risks of problems during pregnancy. So we need to stop looking at weight gain always as a bad thing. And last but not least, of course, there are risk factors for us people living with HIV gaining weight. But actually, the reality is that it is in line with the general population we are putting on weight, and there are lots of other reasons and benefits for us putting on weight. And I'll just speak on in a couple here, return to health. Aging, putting on it is part and parcel of aging. So, for example, for me as a menopausal woman, I've put on age over the years. I've got 2 or 3 bellies, but that's, part and parcel of my aging process. And so please, let's stop penalizing these better tolerated, less toxic drugs by also focusing on the weight. And I'll just finish by saying that actually I started taking medication in the earlier years, and I was a svelte size 8'10" for many years, but actually it was at the risk of, I had severe gastrointestinal problems, which is just severe diarrhea to you and me. So, my quality of life wasn't as good. So please, let's stop penalizing these less toxic, better tolerated drugs in arguing about the weight gain. Thank you very much.